Hello, my name is Stephanie. I'm a registered nurse and I'll be discussing an in-class activity based on one of the 6 quality and safety education for nurses competency areas. So we can go ahead and take a look at slide 2. The Quality and Safety Education for Nurses project, they created quality and safety competencies. They created 6 of them: patient-centered care, teamwork and collaboration, evidence-based practice, quality improvement, safety, and informatics. For each competency, they define knowledge, skills, and attitudes. We'll be focusing on one of the competencies, evidence-based practice, which is in slide 3. In order to make a patient care decision, we need to consider 3 things: the best scientific evidence, clinical practice, and patient preferences and values. Based on the evidence-based practice competency, an in-class learning activity will be developed and discussed. Students will also be grading the evidence based on the evidence-based hierarchy, which you can see here. For slide 4, we're going to be talking about the learning activity and the background information, in particular falls. Falls are a common incident in both an acute care setting and a long-term care setting. The risk of a patient falling in the acute care setting is approximately 1.9 to 3% of all hospitalizations. This doesn't seem like a large number, but if you consider all the hospitalizations in a year, this amounts to over 1 million patient falls. The risk of a patient falling in a long-term care facility is 29 to 55% during a patient's stay. Falls are a cause of morbidity and mortality, especially in elderly patients. One common fall prevention measure are alarms. So if you look at slide 5, this is the learning activity objectives. These objectives are based on the QSEN competency areas. The student will participate effectively in appropriate data collection and research activity. This will be done by conducting a literature review. And to evaluate the group process or the participation, each student will complete a group assessment. The second learning objective is using the internet in the college's online library. The student will locate evidence reports related to fall prevention measures and guidelines. And finally, the student will describe the strength and relevance of available evidence that influence the choice of intervention for fall prevention. So the students will grade the evidence based on the evidence-based hierarchy. For the learning activity, the students need to prepare in advance. They need to read the following material that is listed here. They also need to bring their textbook along with their tablet or laptop computer to class. Then on the day of class, the instructor will divide the class into small groups comprising of about 3 to 5 students. So if you take a look at slide 7, the group is going to conduct a literature review for the following PICO questions that the instructor created. So there will be 4 PICO questions, and so group 1 will have this question: in elderly, what is the effect of pull pin magnetic pull cord alarms on prevention of falls? So how effective are these alarms at preventing falls? The second group will then look at sensor pad alarms. The third group, motion detector alarms, and the fourth group, pressure-sensitive floor mats with alarms. So for the learning activity, the internet or college's online library will be used, and each student in the group is to read and critique at least one resource. The resource should be peer-reviewed, and it should not be older than 5 years. Then the students are going to combine their results or their information in a group paper. The paper should be about 2 to 3 pages in length and in APA format. The paper should include an introduction, body, conclusion, and reference page. On a different date, a later date, each group is going to be discussing their paper. Finally, after they conduct a literature review, each student will need to complete a group assessment. The group assessment, there are 3 things that need to be accomplished. The student is going to create a list of their contributions, and then the contributions of each of their group members, and then the process as a whole. So what worked or what didn't work. So if you take a look at slide 9, this is how the learning activity will be graded. It will be graded according to the literature review rubric. The project is worth 90 points, and it can be calculated by the performance rating scale multiplied by criteria equals the total points of 90. So the performance rating scale, it ranges from 0 points to 10 points. And the criteria, there are 9 of them. So for each criteria, a student can have 0 points all the way up to 10 points for a total of 90 points. So slide 10 shows the performance rating scale. So the student would get 10 points for exceptional work, where the work meets or exceeds criterion at a high level of competence, and they would get 0 points for absent. The criterion is not met or the work is absent. Now we need to review the criteria for the paper, which is in slide 11. So the paper, the students need to use correct spelling and grammar. The paper needs to comply with APA format, especially for the reference page. The paper meets the length requirements of about 2 to 3 pages. The introduction needs to have the PICO question in there that the instructor created. The introduction also needs to include the explanation and criteria to be used to analyze and compare the literature. So this would be the evidence-based hierarchy. The criteria is continued on slide 12. The body should summarize individual studies or articles and needs to reference at least 3 sources. The conclusion summarizes and evaluates the literature and then focuses back on the introduction. The conclusion also states flaws or gaps in research, inconsistencies in findings, or further research that needs to be conducted. And finally, the group assessment will be completed. So this in-class learning activity, it was designed based on the evidence-based practice competency from the QSEN project. So nursing faculty, whether it's for pre-licensure or graduate students, need to incorporate these competencies into their curriculum to prepare future nurses in these areas. Thank you.